So this is the science that deals with the effects of drugs on living system. Initially, I'll show you some definitions because these definitions are important. You are giving exam on pharmacology, and if you don't know definitions of drugs, definitions of therapy, toxins, medications, dose, etc., if you don't know that, then there is no use of it. Something you have to know. You have to know. Okay? Something you should know, something you have to know. These definitions you have to know, like the definition of drugs. This is the first question asking by me. What is drugs? ये भूल जाओ. What is drugs? In your own words, what is drugs?
Medicines we take to bring any change in our body.
ये थोड़ा आसपास हो सकता है खुद के वर्ड पर. But whenever, if you say this also, that's also okay. Suppose याद नहीं है, कुछ तो बोलना पड़ेगा. So ये भी अगर बोल दो any medicine which causes changes in our body, that also okay, चलेगा. At least एक में से 0.5 तो मिल ही जाएगा. But the perfect definition, obviously, if some organization involves, it will contain some problem. So whenever there is some organization involved, so definition, they make it a little bit elaborate and almost complete. So here you can say, as per WHO, it defines drug as any substance or product. Medicine, this is a focal word. Okay, it may not be medicine also. Suppose you are chewing the leaf of tulsi. Directly, this is not a medicine. This is just a leaf, right? Right or wrong? Okay? So what it does? It relieves your cough. So can you tell the leaf of tulsi as medicine? No, but it contains some substance. Okay, when you break down the phytochemicals of the tulsi leaf, it will show the presence of certain chemicals. Okay. When you isolate those chemicals and formulate it in such a way that you can have it in the form of syrup or tablets, then we call it medicine. Okay. But the leaf of tulsi does some works. So in this case, any substance or product that is used or intended to be used, to modify or explode physiological system or pathological states, this word is important, for the benefit of the recipient. It has to do some benefit. Suppose we have given you paracetamol. What it will cause? It will relieve your fever. Everyone knows it, right? So in case of paracetamol, it is causing the benefit of the patients. But in case you have given arsenic also a chemical, right? So what arsenic causes? Poisoning. Simple word, poisoning. Simple word. Complicated mat karo. I'm telling you again and again. In case of any oral examination, always answer simply. Complicated पूछोगे तो examiner पकड़ लेगा तुम लोग. There are some tricks to get good marks and to be show yourself as better. Always start with simple things. Yeah? Again, any substance or product that is used or intended to be used to modify or explode physiological system or pathological state for the benefit of the recipients. So if any chemical does some changes in the physiological system towards the harmful effect to any human or animal, that is known as toxins or poison in simple words. Okay? Let's go to the second, pharmacy. Pharmacy, जब भी तुम लोग कोई मेडिसिन लेते हो, कुछ फॉर्म पे आता है, राइट? टैबलेट्स, सिरप या कट गया तो बोरोलिन लगा दिया. What is बोरोलिन? What is the form? This is an ointment, right? So the science which deals with the preparation, preservation, standardization and compounding and proper utilization of drugs, this is known as pharmacy. Previously in pharmacology practicals, pharmacy was included. तो उस पर तुम लोगों को क्या दिया जाता था? Suppose you make ORS. How ORS is made? ORS तो जिंदगी में सब लोगों ने कभी ना कभी तो खाया होगा डेफिनेटली, राइट? क्या होता है उसका? सॉल्ट होता है, ठीक है? ORS का फुल फॉर्म क्या है? Oral rehydration? No, salt. Whenever you mix this salt with the water, then it will be solution. आता तो है पाउडर पे. So never say, everybody make this mistake, so you are not the only one. Even जब मैं second year पे था, मैंने भी same mistake ही किया था पहले बार. It is the salt. Whenever you mix this salt with water, in particular amount of water, that is known as solution. Okay, वो पैकेट जिस पे ORS लिखा होता है दैट इज सॉल्ट, देख लेना पैकेट पे। तो उस पर होता क्या है, किसी ने देखा है पीछे पीछे? सब लोग तो काट के खा लेते हो, कंटेंट देखा है कभी? क्या क्या होता है? सोडियम, पोटेशियम, सोडियम क्लोराइड, पोटेशियम क्लोराइड, डाइसोडियम साइट्रेट, ग्लूकोज एक्सेट्रा। ठीक है, वो बाद में आएगा, और इसका क्लास होगा अलग से। ठीक है, सो दैट मेकिंग comes under pharmacy. So previously this practical was there. You were asked to make some ORS salt or solution, then ointments, etc. ठीक है, टैबलेट्स ऑल्सो देयर आर, टैबलेट पे सिर्फ वो केमिकल नहीं होता है। सपोज यू आर हैविंग एंटीबायोटिक्स, से एमोक्सिसिलिन लेके चलते हैं, ठीक है, तो इन दैट टैबलेट देयर इज नॉट ओनली एमोक्सिसिलिन एंड क्लेवेनिक एसिड, देयर आर सर्टेन other things also which is known as excipients. So excipients का फंक्शन क्या है? टू प्रिजर्व द ड्रग, उसका शेल्फ लाइफ बढ़ाओ, एक्सपायरी डेट थोड़ा लंबा करो, ठीक है, ओके। सो दीज आर द फंक्शन ऑफ एक्सिपिएंट्स। सो दैट प्रिपरेशन, दैट साइंस ऑफ प्रिपरेशन जिस पे ये सब कुछ सिखाया जाता है, दैट इज नोन एज फार्मेसी। ओके, व्हाट इज थेराप्यूटिक्स? इजी है, द साइंस ऑफ ट्रीटिंग एनी डिजीज और एलिमेंट। Chemotherapy. Now, firstly, when you hear this word chemotherapy, what comes under your mind? Cancer, exactly. But not only cancer comes under this. Chemotherapy is the science of treating any disease towards its cure. Towards its cure. What do you mean by this? Towards its cure. Cure means totally resolving the problem. That disease does not exist in your body anymore. For example, you are treating a patient with hypertension. Let's say you are treating a patient with hypertension. Take. So you are giving some drug, the pressure is normal. Is the disease completely cured? If you stop the antihypertensive drug, what will happen? BP will shoot again. So this is not cure. You are having any infections, let's say common cold. Now you have given as azithromycin. So सबसे common brand name है Azithromycin 500, right? सब लोगों ने लिया होगा कभी ना कभी। क्या यहाँ पे कोई है जिसका कभी LRT नहीं हुआ? तो फिर वो डेफिनेटली एलियन है, ठीक है। When you take azithromycin for 5 days, your common cold is completely cured, correct? azithromycin stop कर दिया, वो क्या फिर से होगा? It will happen only if there is another infection, right? So that is known as complete cure. Okay. So if you stop it, then जो infection है common cold है, that won't happen, right? This is known as cure. Similarly, it happens in case of cancer also. Likely, if the diagnosis happens in a proper time, if the cancer does not spread, chemotherapy session के बाद cancer वापस आएगा नहीं. It may relapse later on, but that cancer for that time being is cured. अगर तुम stop भी कर दोगे तो वो आएगा नहीं. So in this case, the treatment which we are doing in a hypertensive patients, that does not come under chemotherapy. Chemotherapy means complete cure. Even if you stop the drug also, the disease won't come back again. Okay? So it deals with cancers and infectious diseases particularly. Non-communicable disease, that does not come under the concept of chemotherapy. It comes under the concept of therapeutics. Doubt clear है कि नहीं? Okay, right. Toxicology, this is not actually our part directly. Mostly forensic will deal with it. Okay, so you'll get toxicology mostly in case of in your phase 3. Okay, but whenever toxicology means is the study of poisons, their action, detection, prevention, and the treatment of poison. Usually, we treat most of the poisons. We have antidotes. Okay, so with the antidote, the therapy and everything, we'll cover it a little bit, but mainly this will comes under forensic. हमारा एक छोटा सा यूनिट है, ये आ जाएगा कभी। क्लिनिकल फार्माकोलॉजी, Now, this is the systemic study of a drug in humans, both in healthy volunteers and patients. What does it mean by healthy volunteers? When we give drug to a healthy person, when we can give drug to a healthy person, do you have any idea that how the drug comes to the market, its process? Trials, exactly. कौन बोला? Very good. अरे वाह, परवर क्या आ गया क्या? Right, exactly right. So usually whenever any drug comes to the market, it does not come directly. We have to ensure that the drug is effective, that chemical is effective. Initially we don't call it as drug. It is just a simple chemical. Okay. So first we test it. Firstly we test it in animals, right? चूहा हो गया, खरगोश हो गया, guinea pigs, hamsters, etc., monkey, cat, etc., except humans. Firstly, we do test in cell cultures or living animals. Then if we see that, okay, some effect is happening without killing that animal, okay, then we do some clinical trial phases. Okay, it is a big topic, it will come later on. Clinical trials, okay. So in clinical trial, initially there is phase 0. पहले phase 1 हुआ करता था, but now there is one small phase has been introduced, that is phase 0. तो phase 0 में क्या करते हैं? We give a small amount of drugs to see the behavior of that drug in our body. कहाँ जाता है, क्या करता है, whether it is going to liver or directly to the kidney or some other places. Okay. And what is its action in the body? We give in very small dose in microgram. Okay. Then after phase 1, phase 2. Till phase 2, we give the drug in volunteers just to see its toxic effects, whether this drug has any harmful effect to the healthy person or not. Phase 3 से आता है drug का efficacy. Then we take 2 groups, one is ill and one is healthy volunteers, and we compare. Okay. After successful phase 3, it comes to the market, which is known as phase 4. Then in pharmacology, we have an important topic, that is pharmacovigilance. I hope तुम लोगों ने देखा था वो बैनर्स वगैरह, pharmacovigilance week. September कब था? Can anyone remember the date? 17 to 23. Okay. So every year we'll celebrate pharmacovigilance week. Next year also we'll celebrate. और इस साल तो एक्चुअली तुम लोग का एग्जाम था, तो ज़्यादा कुछ कर नहीं पाए. But from next year onwards, we'll do something bigger, like debates, various competitions. How many of you can act? कैसे acting तो सबको आता है, but performance acting. How many of you can act? नाटक किसको करना आता है? वो वाला नाटक नहीं, actual नाटक. Please raise your hand. अरे यार come on. अच्छा एक मिल गया, बट ये रहेगा नहीं पता नहीं मुझे. अच्छा ठीक है, तो हाथ उठाओ ना. अगर आता है तो हाथ उठा दे, ऐसे हाथ उठा दे, दोनों हाथ उठा दे, ठीक है. I need some actors. So we'll do lots of things in that pharmacovigilance week. That will actually make our institute also known to the other parts of India. ठीक है. तो ये गया clinical pharmacology. Then this is a very important topic in theory as well in Viva. Essential medicines. Now, why this essential medicine term is important? This term is important because there are certain drugs which are life-saving, right? जैसे atropine, isoprene हो गया, then Dexona, Avil. Okay. So what the government do? They criteria some medications as National List of Essential Medicine. In short, NLEM. Okay. Presently, there are around 356. It may increase this time. Another list has come out. That is not published publicly. But last report, as per 2022, there was total 356 medications. तो उसका importance क्या है? That importance is that this group of drugs, जो essential medicine पे included है, that has to be kept by most of the pharmacies. And the price is regulated directly by the government. So that what happens? The price is very less. You just go and buy an ampoule of tetanus. कितना cost है? Toxicology का 10-13 rupees max. ठीक है. Atropine is a life-saving drug. It's one ampoule costs around only 8 or 9 rupees. Okay. But this much of amount, the companies which manufacture, they are hardly about to get any benefits. So in case of essential medicines, and another concept is there, orphan drugs. So in those cases, government used to give subsidies. Okay, ताकि वो सब चीज़ें available रहे. So by definition, essential drugs, there's also WHO has given a very nice definition that drugs are those that satisfy the healthcare needs of majority of the population. They should be assured quality, available at all times in adequate quantities and in appropriate dosage forms. They should be selected with regard to disease prevalence in a country, evidence on safety and efficacy, and comparative cost effectiveness. दो ड्रग ले लो, पेंटोप्राजोल, ओमेप्राजोल, ठीक है? क्या करता है ये ड्रग? पेंटोप्राजोल, ओमेप्राजोल. What does they do? मतलब फंक्शन क्या है उसका? एसिडिटी मीन्स बेसिकली इट रिड्यूसेस एसिडिटी इन स्टोमक, राइट? अब पेंटोप्राजोल का प्राइस कम है, ओमेप्राजोल का थोड़ा सा ज़्यादा है, ठीक है? सो व्हेन दिस वर्ड कम्स कॉस्ट इफेक्टिवनेस, देन वी कंपेयर दिस टू ड्रग्स कि सपोज पेंटोप्राजोल का प्राइस तो है कम, सो दैट विल बी मोर अफोर्डेबल टू पब्लिक, राइट? कॉमन सेंस. हम लोग अभी भी मिडिल इनकम कंट्री है. ओके, जीडीपी पर कैपिटा ओनली $2,700, 20,000 नहीं है, ठीक है? सो वी हैव टू थिंक अबाउट मनी. सो सपोज तुमने लिख दिया पेंटोप्राजोल, it will have some efficacy which is obviously less than omeprazole. Okay, now compare that whether this price of pantoprazole and effect of pantoprazole combinedly better than omeprazole or not. अगर ये आ गया तो pantoprazole will be deal under essential medicine, omeprazole वहाँ पे होगा नहीं. And in case if omeprazole becomes better, then omeprazole will be in the essential list, pantoprazole will be. ठीक है? That is the known as term as cost effectiveness. There is a very complicated formula, ज़्यादा confuse हो जाओगे, ठीक है? So these are the some examples are there. So some drugs like iron and folic acid, which is very important in pregnancy, ठीक है? Then anti-tubercular drug हो गया जैसे rifampicin, isoniazid, those things हो गए. So they are necessary because pregnancy तो होगा, and pregnancy में anemia भी होगा, तो follow up भी चाहिए, ठीक है? Treatment भी चाहिए prophylactically. TB in India, TB is very highly prevalent, but in fact in worldwide also TB is very highly prevalent. So TB, anti-tubercular drugs, they are very important for the society. Okay. So these drugs are some examples which comes under essential medicines. Okay. Clear? Then orphan drugs. Some diseases are very rare, like Digoxin is a drug which we previously was very commonly used in heart failure, but nowadays we don't do because of many reasons. वो आएगा बाद में, ठीक है? So Digoxin has a very high propensity of causing toxicity, even in therapeutic doses as well. Okay. So if toxicity happens, we need some antidote. So for Digoxin, we have Digoxin antibody as an antidote. Okay. Then I hope पेपर में अपने पढ़ा होगा देसी दारू पी के लोग बीमार पड़ गए. Why they fell ill? They fell ill because when the local liquor is made, it is not refined that well. With ethyl alcohol, it contains also methyl alcohol. The toxicity happens mainly for the methyl alcohol, not ethyl alcohol. Okay. So for methanol poisoning, we have antidote known as fomepizole. But this also happens very rarely. और जहाँ पे होता है वहाँ पे लोग ट्रीटमेंट के लिए जा नहीं पाते, लेवेज करके के काम खत्म, ठीक है? तो सपोज दिस काइंड ऑफ ड्रग, अनदर ड्रग नाम लिख सकते हो, प्रोटामिन सल्फेट. Protamine sulfate. Have you listened to the drug named heparin? What does it do? Anticoagulant. Okay. So if we give heparin in a very high dose or untitrated dose, it will cause toxicity resulting into bleeding or many things will happen. So for heparin toxicity, we have protamine sulfate. But that also happens very rarely because nowadays we use low molecular weight heparin. Okay. It does toxicity very rarely. तो सपोज प्रोटामिन सल्फेट का एक एम्पूल सेल होगा साल में सिर्फ एक या दो, तो कंपनी का फायदा है मैन्युफैक्चरिंग में? Does the manufacturer will gain any kind of profit? Yes or no? अगर सेल ही नहीं है तो कहाँ से प्रॉफिट होगा, राइट? सो एज अ रिजल्ट ऑफ दैट व्हाट विल हैपन, the company will stop manufacturing these drugs. But these drugs are very important. So there also comes this concept of subsidy. What does the government do? They take over all the charges, all the formulations, and these drugs are made in small amounts in certified government manufacturing companies. Or if any private company does manufactures it, they will get क्या subsidy. भाई आप लोग बना लो, पैसा हम लोग दे देंगे, ठीक है? You won't get any kind of losses. The basic profit will be the government will provide, but just you manufacture, तुम लोग भाई बना लो, ठीक है? So that definition is that drugs that used for the diagnosis, treatment or prevention of rare diseases. The expenses incurred during the development, manufacture and marketing of drug cannot be recovered from selling of the drug by the pharmaceutical companies. So give 2-3 examples. Digoxin antibody, Pharmacovigilance, Protamine Sulfate, etc. ठीक है? Then सबसे common चीज OTC drug. How you buy medicines? हमेशा डॉक्टर को दिखाते हो? Let's suppose let's consider the general public. Does they buy medicine always after going to a doctor? क्या करते हैं वो लोग? What does they do? वहाँ पे फार्मासिस्ट ही डॉक्टर है, राइट? अरे सर्दी भाई यार 2 एंटीबायोटिक दे दो, ठीक? दैट शुड नॉट बी द वे. सो फॉर दैट क्राइटेरिया वी हैव ए लीगलाइज्ड पोर्शन नोन एज ड्रग रेगुलेशन एंड ड्रग शेड्यूल्स. ओके, इट कम्स अंडर वन एक्ट नोन एज ड्रग्स एंड कॉस्मेटिक्स एक्ट 1945. लिख लो, दैट्स इंपॉर्टेंट वर्ड. ड्रग्स एंड कॉस्मेटिक्स एक्ट 1945. So in that case there are lots of schedules. उसमें से एक शेड्यूल है शेड्यूल H. एंटीबायोटिक के फॉइल के पीछे देखा शेड्यूल H. What is शेड्यूल H? Only under doctor's prescription. But ironically it does not happen until unless the drugs are very highly regulated, जैसे एंटीसाइकोटिक ड्रग्स हो गया, स्लीपिंग पिल्स हो गया, ठीक है? ओके. So by definition OTC the full form is over the counter drugs. So OTC is that OTC, otherwise it's known as non-prescription drugs. So these are the drugs that can be sold to a patient without a validated paper from a registered medical practitioner. Doctor भी लिख सकते हो, but if you use this for registered medical practitioner, that clears up the way. Even when you do your internship, you will also be a doctor. But till then also you won't be a registered medical practitioner. You won't be registered under any medical council. After you register under a medical council, then you will be known. Then you will be allowed to give prescriptions, and your prescription will be validated. Okay. And prescription drugs, जैसे for example, simple drugs like vitamins, paracetamol, antacids. Okay. These are few examples of OTC drug. Now, which drug comes under this criteria? हम लोग कैसे सिलेक्ट करते हैं कि ये ड्रग OTC होगा, ये ड्रग प्रिस्क्रिप्शन ड्रग होगा? Why paracetamol comes under OTC, antibiotics comes under prescription drug? What is the logic behind it? Antibiotic also is needed in case of fever, right? Fever तो तभी होगा जब कोई infection रहेगा. So for the same, right? But that comes only in case of antibiotics. I'm not a generalist. जैसे antihypertensive drug हो गए, so that also comes under prescription drug, isn't it? स्कोप ऑफ एब्यूसिव एंड CNS ड्रग पे होता है. जैसे तुम लोग एब्यूसिव के लिए तो एम्लोडिपिन तो नहीं खाओगे ना. नहीं, सब लोग एंटीमाइक्रोबियल पे क्यों करते हैं? बी जनरलिस्ट. No, suppose one patient has checked his BP. अब आजकल तो डिजिटल मशीन ऑलमोस्ट हर घर पे, राइट? तो कोई पेशेंट ऐसे ही चेक कर लिया कि मेरा बीपी हाई है, दुकान पे जाके बोल देता हूँ. बट दैट कम्स अंडर प्रिस्क्रिप्शन ड्रग. ना जैसे अच्छा ठीक है, बट ये तो दुकान वालों को भी पता है ना कि एंटी हाइपरटेंसिव मेडिकेशन स्टार्ट में टेल में देना. OTC is considered to those drugs which causes very less or practically zero side effect. अब विटामिन खाने से कोई साइड इफेक्ट होगा? जितना एब्जॉर्ब होना है हो जाएगा, बाकी निकल जाएगा, राइट? Iron is also a nutritional supplementation, but it comes under prescription drug because iron tablets, it causes lots of side effects like constipation, gastritis, liver toxicity, etc. Right? So those drugs which causes practically zero side effects, they only comes under prescription drugs. The paracetamol का practically कोई side effect नहीं है until unless you are having 40-50 tablets. अब इतना टैबलेट कौन खाए? अगर किसी को सुसाइड करना है तो कैसे खा सकते हैं? ठीक है. विटामिन सप्लीमेंटेशंस नथिंग. एंटासिड्स प्रैक्टिकली जीरो, राइट? आज तक किसी को साइड इफेक्ट हुआ है क्या एंटासिड खाने के बाद? रिलीफ ही होता है, राइट? ठीक है. सुक्रालोफेट प्रैक्टिकली जीरो साइड इफेक्ट. तो सुक्रालो कोई भी ले सकता है. इट कम्स अंडर OTC. But those drugs which has a little bit of monitoring or advisory for side effects or regulation of use, dosing, how to take the dose, when to take the dose, what is the frequency, that comes under prescription drugs. These drugs that can be obtained only upon producing prescription by a registered medical practitioner. This is what is important. Registered medical practitioner. जैसे antibiotic हो गया, CNS drugs हो गया, antidepressant, antipsychotics, antihypertensives, thyroid medications, all those examples. Technically, 90% of the drugs, they are prescription drugs. Only 10% comes under the OTC, but present situation पे उल्टा हो गया. 10% comes under prescription drug, 90% comes under OTC. ठीक है. Always you should encourage your known people that not to take prescription drugs as OTC medication. That's your responsibility. तुम लोग के घर पे जाके मैं तो बोलने वाला बोले, तो अपने लोगों को खुद ही एडुकेट करो प्लीज. ठीक है. Because charity begins at home. If you don't serve your home, then social service का कोई फायदा नहीं, right? Now there are two important terms in pharmacology. One is pharmacokinetics and one is pharmacodynamics. In simple words, pharmacokinetics deals with all those knowledges that what our body does to the drug. अब suppose एक tablet खा लिया तुमने. You have taken a tablet. What will happen? Step 1. पानी लिया, टैबलेट लिया, निकल लिया. फर्स्ट क्या होगा? लीवर से पहले. लीवर पे तो डायरेक्टली थोड़ी ना ब्लड स्ट्रीम के थ्रू टैबलेट जाएगा. फर्स्ट इट विल ब्रेक डाउन एंड इट विल डिजॉल्व इनटू द गैस्ट्रिक जूस. अब सॉल्यूशन क्यों इंपॉर्टेंट है? Because that solution is the only one which is able to get absorbed. अब पूरा इंटेक्ट टैबलेट थोड़ी ना ब्लड पे घुसेगा, राइट? सेम थिंग हैपेंस टू इंजेक्शंस. व्हेन यू गिव एन इंजेक्शन, it gets dissolved into the bloodstream and its active molecule comes into, it becomes open up, right? Correct? ठीक है. So in pharmacokinetics, in short, there is a term known as ADME. क्या बोला अभी? ADME. A for absorption, D for distribution, M for metabolism, E for excretion. Firstly, the drug will get dissolved and it will absorb whichever route you have given. Suppose you have given ointment, it will absorb from the skin. You have taken nitroglycerin sublingually, it will absorb from the buccal mucosa. ठीक है. So depending on the route of administration, the drug is going to behave. ठीक है. That is known as absorption. Then after absorption, what will happen? The absorbed drug that will go to the bloodstream, right? अब blood बहता रहेगा, बहती हवा सा था वो, ठीक है. तो बहने के बाद क्या होगा? It will go to its site of action or in the whole body. So this is known as distribution. The drug from the site of administration, it will get dissolved. It will get distributed. सपोज मुझे अभी तुम लोगों को कुछ चॉकलेट देना है, नहीं दूंगा, ऐसे डिफिनेशन, ठीक है. So what I'll do first? I'll bring a box. I'll take it through the door. So that door is the route of administration. ठीक है. Then मैं यहाँ पे रखूँगा, रख के इसका खोलूँगा बॉक्स को. खोलना तो पड़ेगा ना बॉक्स को. So that opening up of that box is क्या? Dissolving. देन एक एक करके सबको दूंगा, दैट इज डिस्ट्रीब्यूशन. ठीक है, उसके बाद क्या क्या होगा, तुम लोग चॉकलेट को खाओगे, मीन्स यू विल यूटिलाइज इट एंड यू विल प्रोसेस द ड्रग. बॉडी पे भी सेम होता है प्रोसेसिंग ऑफ द ड्रग. एनीथिंग यू आर एडमिनिस्ट्रिंग एक्सटर्नली, body won't keep it. It will try to withdraw it. But beforehand, before withdrawing the drug will cause its action. Okay. That part comes under pharmacodynamics. ठीक है. So that action को अभी भूल जाओ. ठीक है. So after that action, the drug will get metabolized, maybe in liver, maybe in spleen, maybe in bloodstream. That is that M, metabolism. And after metabolism, or some drugs does not metabolize, they get excreted as it is. ठीक है. This is known as excretion. It may be through sweat, maybe through breathing, maybe through urine, maybe through feces. Okay. So that is known as excretion. So ADME, absorption, distribution, metabolism, and excretion. We'll discuss these things in details. Okay. Then comes pharmacodynamics. Simply what the drug does to the body. अब तुमने एक एंटीबायोटिक खा लिया, वो कुछ करेगा, क्या करेगा? अब एंटीबायोटिक सबका फेवरेट है, इसलिए मैं एंटीबायोटिक का एग्जाम्पल दे रहा हूँ. क्या करेगा वो? क्या करेगा? एंटीबायोटिक क्या करता है? व्हाट इज इट डज? अरे एंटीबायोटिक क्या करता है? कब कॉम्प्लिकेटेड मत सोचो, कीप इट सिंपल. आई ऑलवेज से कीप इट सिंपल. Yeah, how does it clear infection? It causes some reaction with the microbials, maybe destruction of cell wall, maybe hampering its metabolism, maybe some other way. Okay. If you have taken antihypertensive medications, it will do something to reduce the blood pressure. So the action of a drug and the mechanism by which it does something to the body to restore the optimal physiological state, that is known as pharmacodynamics. Simple words, pharmacokinetics is what the body does to the drug, and pharmacodynamic is what the drug does to the body. Okay? So इसमें important part is receptors. I hope most of you are acquainted with it. Well, physio or biochem? Physio, na? Physio. So this is the entire process from prescription to the patient's health effects. फर्स्टली प्रेस्क्रिप्शन लिखा जाएगा, वो दिखा के कोई मेडिसिन लिया जाएगा. ठीक है, वो मेडिसिन खाया जाएगा, फिर वो बॉडी पे फैलेगा. समझ में आ रहा है? आ रहा है क्या? अरे क्या आ रहा है क्या? जोर से बोलो ना, जोर से बोला जाए ना तभी. Sorry. That will spread, then that will cause some effect. That part is pharmacodynamics. And then after the effect, the drug will metabolize and it will be excreted. That again, it comes under pharmacokinetics. So in between two pharmacokinetic status, there is a pharmacodynamic stage. Okay? Then that pharmacodynamics, that will cause the patient's health status. Then sources of drugs. I won't take much time. 10 minute देना पड़ेगा attendance के लिए. Sources of drugs. Firstly, from where we obtain drugs. एकदम पहले कहाँ से मिलता था? लॉन्ग टाइम में, आज से सपोज 2,500-3,000 साल पहले. Plants, mostly plants. There are lots of herbal medications, and nowadays also Ayurveda deal with it. And even nowadays also we get drugs directly from plant sources. Example, quinine. कहाँ से? Simple. We are reading it since our school time, right? ठीक है. Then we have atropine. Any guess? कहाँ से मिल सकता है? Atropa belladonna, plant extract. Atropa belladonna, datura. ठीक है. So nowadays also we get lots of drugs directly from plant sources. Any drug of abuse, मेरे टिम्पेनिक मेम्ब्रेन पे वाइब्रेशन क्रिएट होना चाहिए, अदरवाइज मुझे सुनाई नहीं देगा. एंड आई कैन रीड लिपोपेंस. Sorry. Any drug of abuse, CNS drugs directly from plant sources? Morphine, exactly, morphine. Now why I said this? Because morphine contains all three sources of, means this opioid group of drugs, it contains all three sources of drugs. One is natural sources, that is usually plant. कहाँ से मिलता है? Opium, right? Opium से हम लोग एक चीज़ खाते भी है, क्या है वो? How many Bengalis are there? Okay. तो सबको पता तो हो गए. पोस्तो, आलू पोस्तो, झींगे पोस्तो, पोस्तो बड़ा. Okay, we are quite fond of posto. That is actually opium. Technically, we are taking drugs with it. ठीक है. Then there is खत्म होने वाला है. क्या यूरिनरी इनकॉन्टिनेंस है क्या तुम? नहीं जाओ पाप होगा चल. मुझे पाप लगेगा. Okay. Then second source is semi-synthetic. Means like we take the extract of that plant, then after that we do some chemical reaction to enhance its action. ठीक है, जैसे डाइसिटाइल मॉर्फिन हो गया, it directly comes from the morphine only. Okay, then from atropine we get ipratropium bromide, tiotropium bromide, which is very widely used for COPD or asthma patients. ठीक है, so this is the example of semi-synthetic, means it is produced from plant sources. Okay, then आ गया सिंथेटिक. जैसे हो गया तुम्हारा हेरोइन, LSD. This are drugs which has no relation with plant sources. It's entirely made of chemical. For say antibiotic, we have antibiotics known as linezolid, vancomycin. They are completely synthetic. Plant source का कोई चक्कर ही नहीं रहा. ठीक है. So basically there are sources like plants. Then we have animal sources, some minerals. These all are natural, semi-synthetic and synthetic. Okay? So just see those examples. Even animals also give us some products like insulin. Insulin previously it was made from pork or beef pancreas extracts. Nowadays we have human recombinant insulin formulations. Okay? Then most of the vaccines like anti-venom serum. Any idea how does it make? आफ्टर स्नेक पॉइजनिंग हम लोग तो सीरम देते ना, एंटीवेनम. हाउ डज इट मेक? अ स्मॉल अमाउंट ऑफ वेनम्स आर इंजेक्टेड इनटू हॉर्स ब्लड. सो इट कॉजेज सम रिएक्शन दैट विल कॉज सम एंटीबॉडी. वो एंटीबॉडी कलेक्ट किया जाता है, दैट रिफाइंड एंड दैट कॉजेज दिस एंटीवेनम सीरम. ओके, सो दीज आर द सोर्सेस. देन रूट्स ऑफ ड्रग एडमिनिस्ट्रेशन. How we are administering the drugs. What are the routes of drug administration you can say without watching anything? Oral हो गया. Then injection हो गया. Anything else? Huh? Okay, ये हो गया. Then ideally if you are answering properly, then there are broadly two ways of route of administration. One is local or topical and one is systemic. Okay. Now this local means you are administering the drug just to act on that particular site. Like you have some injury and over the injury you are applying some antiseptic ointments. That is local, right? सर्दी हो गया, you are taking nasoquin spray. ये कहाँ पे काम करेगा? नाक पे स्प्रे करो, नाक पे ही काम करेगा, राइट? राइट? ठीक? Another one is systemic. It contains most of the routes, like oral tablet हो गया, ठीक है? Then injections, or it is known as parenteral. Oral known as enteral. It comes from the word intestine, enteral, and parenteral means you are bypassing the enteral route. So enteral and parenteral. Oral tablets, capsules, whatever you are taking, these all comes under the word enteral. And injections like intravenous, intramuscular, subcutaneous, sublingual, where we are administering the drug directly into the bloodstream, bypassing the alimentary tract, that is known as parenteral. Clear? That will be discussed everything in details. Okay, so local route, systemic route. So this is everything. We'll be discussing it nicely. Then there are certain special drug delivery systems. Suppose you are about to give some chemical or drugs to the eye. Okay, and this drug need a constant administration for say 3-4 days. अब 3-4 days में तुम आँखों पे कितनी बार ड्रॉप दोगे? So for that we have a technique known as Ocusex. It is a small device which contains the drug and it is made in such a way that धीरे धीरे करके ड्रग निकलता रहेगा in small amounts for a certain period of time. Okay, it depends on the size, the dose requirements, etc. Okay, this is known as Ocusex. Then patches are there, jet injections, liposomes, monoclonal antibodies, they all are there. So that will be discussed later nicely. And then for some terms are there agonists and antagonists. It will comes under the topic pharmacodynamics. ठीक है. Now एक चीज़ दिमाग में रख लो. If we say with the word agonist, what is it? You must have come across this in first year, right? What is agonist? Agonist is some chemicals that bind with some receptors and causes some effect. For example, जैसे तुम्हारा in case of ANS, there are two types of receptors, adrenergic and cholinergic. ठीक है. So let's take M2, adrenergic, cholinergic receptor. Now M2 causes reduction in heart rate, bradycardia. ठीक है. Now suppose हम लोगों ने कोई ड्रग दिया जो M2 रिसेप्टर के ऊपर काम करेगा, which reduces the heart rate. जैसे हो गया तुम्हारा एसिटाइलकोलिन. ठीक है. Let's say for example, और भी बहुत सारे example. This is not a good example though, but anyway, let's take it for the time being. ठीक है. So let's take acetylcholine. It acts on M2 receptors to reduce heart rate. Means it's working towards the receptor action. Because M2 receptor भी heart rate decrease करेगा. So here acetylcholine is the agonist of that receptor. Okay. Then come another word, antagonist. What is antagonist? ना, यही तो सब लोग मिस्टेक करते हैं. सपोज कोई केमिकल दिया हम लोगों ने which acts on M2 receptors and it's working oppositely, okay, on the M2 receptors, that is, it will increase the heart rate, right? That is known as reverse agonist. This is not an antagonist. This concept you have to make clear. हमने कोई ड्रग दिया जो रिसेप्टर का जो एक्शन है वही करेगा, दैट इज नोन एज एगोनिस्ट. हमने कोई ड्रग दिया जो उस रिसेप्टर से काम कराएगा ऑपोजिट साइड पे. इट्स वर्किंग विद बाय दैट रिसेप्टर, दैट इज नोन एज रिवर्स एगोनिस्ट. इन सिंपल वर्ड्स, एगोनिस्ट वर्ड तभी काम पे आएगा जब कोई केमिकल या कोई मेडिसिन कोई रिसेप्टर को देके कुछ काम कराएगा. समझ में आया ये चीज? दैट इज एगोनिस्ट. एंटागोनिस्ट क्या करेगा? एंटागोनिस्ट इफेक्ट ऑपोजिट है, बट एंटागोनिस्ट का काम ये है कि हम लोग जाके रिसेप्टर पे बैठेंगे, जाके उसको कोई काम करने नहीं देंगे. ना क्वेश्चन है ऑपोजिट कैसे होगा? नाउ इफ यू गिव सम एंटीकोलिनर्जिक ड्रग्स, इट विल कॉज इंक्रीज इन हार्ट रेट. इफ यू गिव एट्रोपिन, व्हिच इज एन एंटीकोलिनर्जिक ड्रग, दैट विल इंक्रीज हार्ट रेट. हाउ डज दिस हैपन? एनी आइडिया? In every organ, there are simultaneously two systems are working. In heart also, there are two systems working together, which keeps it in balance. Cholinergic system that will decrease the effect, let's say for example heart rate. The cholinergic system that will decrease the heart rate, and there is adrenergic system or sympathetic system that will increase the heart rate. So whenever two systems are working in balance, so heart rate remains within 60 to 100. कोई भी सिस्टम अगर यहाँ वहाँ हो गया तो आइदर ब्रैडिकार्डिया होगा या टैकीकार्डिया होगा. सो व्हेनेवर वी आर स्टॉपिंग द कोलिनर्जिक सिस्टम, एड्रेनर्जिक सिस्टम will work more. That causes the opposite effect. It's not that it is the heart rate is increasing because of the opposite action of that drug. Antagonist, it binds to the receptor and it causes nothing. It stops the receptor from doing any work. ये कॉन्सेप्ट क्लियर करो. If it causes the opposite effect by that receptor, that is known as reverse agonist. Okay? So there are certain antagonism process. जरूरत नहीं है. Competitive antagonist, non-competitive antagonist, that will be dealt in other cases. And another concept known as tolerance. If we take any drug which acts on the receptor for a very long time, so eventually at certain point of time, its efficacy decreases slowly. So this is known as tolerance. Best example is taking drugs, drug abuse. If any person does not have not taken even a single drop of drugs, if we give it a small dose also, it will cause toxicity. Okay. जो लोग रेगुलर ड्रग लेते हैं उन लोग का हाई डोज दे तो सहन कर लेंगे. ठीक है. दिस इज नोन एज टॉलरेंस. एंड दिस टॉलरेंस कम्स विथ दिस कॉन्सेप्ट ड्रग डिपेंडेंस. Drug dependence means the person will be requiring this drug. Either psychologically this may be needed. जैसे one best example is dependence. Boys, हाँ वो हाँ ठीक ही तो बोल रहा था. Smoking, best example smoking. एक बार शुरू कर लिया लग गया. Initially there will be psychological dependence. Means the person will want a cigarette. But if the person does not get any cigarette for a few days, suppose चला गया पहाड़ पे, दुकान कहाँ मिले, खत्म हो गया. The person won't feel any physical problem. इसको कोई problem नहीं होगा, just psychological problem होगा कि नहीं है, थोड़ा सा irritation, एक दिन हो गया, 2 दिन हो गया, then it's okay, अच्छा नहीं मिलेगा, चलो जाने. But suppose anyone is taking drugs, opioid drugs, जैसे cocaine हो गया, heroin हो गया, ठीक है. If they don't take drugs, they will have problem, physical problem. ये psychological है, that thing is dangerous. So there are only 2 types of dependence, that is, एक है psychological dependence and another one is physical dependence. For psychological dependence, we just need some counseling and the motivation, that's enough. But for physical dependence, we need to give the person a proper therapy. जैसे हमारा de-addiction centers वगैरह, ठीक है. So de-addiction is also an important topic, so we'll discuss about this later. So आज के लिए क्लास यहीं पे खत्म.